Hi friends, welcome back to my channel. Today I am going to discuss a very important topic, that is basic life support. And this topic is for mainly medical practitioners, dental practitioners and also for the healthcare providers. As a healthcare provider, we must know about basic life support. So let's begin. The basic life support, it generally refers to the type of care that first responders or healthcare providers and public safety professionals provide to anyone who is experiencing cardiac arrest, respiratory distress, or an obstructed airway. It requires knowledge and skills in cardiopulmonary resuscitation using automated external defibrillators and relieving airway obstructions in patients of every age. Cardiac arrest remains a leading cause of death in many countries. About half of the cardiac arrests are unwitnessed. Only about 10% of adult patients with non-traumatic cardiac arrest who are treated by emergency medical services survive to hospital discharge. What are the signs of cardiac arrest? CPR is a life-saving procedure for a victim who has signs of cardiac arrest. So we must know what are the signs of cardiac arrest. When the victim is unresponsive, no normal breathing and no pulse. Let's see what is the basic life support chart. It can be memorized as doctor's ABCD. That is DRS ABCD. So, first step is look for any danger. That is, scene safety is very important. Ensure that the area is safe for yourself, others and the patient. Then check response. As I said, unresponsiveness is a sign of cardiac arrest. So, second step is check response. Check for response by ask his name and tap on the shoulders and shout. If there is no response, then send for help. If there is response, then the patient may be more comfortable and monitor the response. Then, next step is the send for help. Call for an ambulance or ask another person to make the call. Then A, that is check airway. Open the mouth if any foreign material is present or not, and place in the recovery position and clear airway with the fingers. Then B, that is check breathing. So check for breathing, look, listen and feel. If there is not normal breathing or gasping breathing, then start CPR. And if there is a normal breathing, then place in recovery position and monitor breathing. The next step is common CPR. CPR of the rate of 100 to 120 per minute with the ratio of 30 compressions and 2 breaths. So continue CPR until help arrives or the patient recovers. Then finally, it is D. That is use of a defibrillator. Apply defibrillator if available and follow the voice prompts of AED. That is automated external defibrillator. So these are the various steps related to the basic life support chart. Doctors ABCD. Danger, response, send for help, check airway, check breathing, command CPR and use defibrillator. That's clear? Okay. So coming to the important step, that is cardiopulmonary resuscitation. That is CPR. As I said, it's a life-saving procedure for a victim who has the signs of cardiac arrest. What are the main components of CPR? Chest compressions, airway and breathing. So these are the main components of a CPR. Okay. how can CPR be performed? Start compressions within 10 seconds after recognizing a cardiac arrest. Push hard and fast. Compresses at a rate of 100 to 120 per minute. Depth of at least 5 cm, that is 2 inches for adults, not more than 6 cm. And advised complete chest recoil. Minimize various interruptions in compressions and give effective breaths. Check for chest rise. Avoid excessive ventilation. And at a ratio of 30:2. What is a chain of survival? It is a series of steps that can be taken to improve the chances of survival for someone experiencing sudden cardiac arrest. This is the updated AHA adult chains of survival. This is out of hospital cardiac arrest and this is in hospital cardiac arrest. So this is the activation of emergency response, high quality CPR, defibrillation, advanced resuscitation, post-cardiac arrest care and recovery. In hospital cardiac arrest, early recognition and prevention, activation of emergency response, high quality CPR, defibrillation, post-cardiac arrest care and recovery. So what is the difference between these two chains? Here this is the first link and fourth link is different. Okay, first link and fourth link. Here it is the first link is activation of emergency response, but here first one is early recognition and prevention. Fourth link is advanced resuscitation like ambulance services, but in hospital cardiac arrest, defibrillation is the fourth link. Okay. This is the pediatric chains of survival. This is the early recognition and prevention, activation of emergency response, high quality CPR, advanced resuscitation, post-cardiac arrest care and recovery. This is in hospital chain. And out of hospital chain, that is prevention, activation of emergency response, high quality CPR, advanced resuscitation, post-cardiac arrest care and recovery. Here also 1 and 4 links are different. Okay. So coming to various links of chain of survival. This is the first link, that is recognition of cardiac arrest and activation of the emergency response system. Early cardiopulmonary resuscitation with an emphasis on chest compressions. Then rapid defibrillation. Here, this is the automated external defibrillator. These are the two pads, AED pads. Here, the position of AED pads in the patient. And the difference of AED pad positions in adult and child more than 8 years. Same pad position for both male and female adult and older child. And for child less than 8 years, pad position for male or female child, and this is the alternate position for male or female child if the pads would touch. Okay. And you can use an AED, that is turn power on. Either open the lid or press the power button depending on the model. First step is turn the power on. Then attach AED pads. Look at the picture on the AED pads. Place exactly as shown. Okay, this is the position of the AED pads. And if the AED advised shock, then shock given. If there is no shock is advised, then I continue CPR. Okay, then this shock button, that is this machine will tell you to press the flashing button if necessary. So that is shock. Okay. And why the defibrillation is more important? It is an important link in the adult chain of survival because it can help to restore a normal heart rhythm for someone experiencing sudden cardiac arrest. So this is the adult basic life support algorithm for healthcare providers. First, verify the scene safety. Whether the scene is safe for the patient and U. Okay. And check for responsiveness of the patient or the victim. Then shout for nearby help. Then activate emergency response system via mobile device. Get AED or emergency equipment, or send someone to do so. And look for no breathing or only gasping, and check pulse simultaneously. If pulse definitely felt within 10 seconds, then if there is normal breathing and normal pulse, monitor until emergency responders arrive. If there is no normal breathing but pulse is felt, provide rescue breathing. That is 1 breath for every 6 seconds or 10 breaths per minute. And check pulse for every 2 minutes. If there is no pulse, then start CPR. If possible, opioid overdose, administer naloxone if available per protocol. And third scenario, if there is no breathing or only gasping, pulse is not felt. By this time, in all scenarios, emergency response system or backup is activated. And AED and the emergency equipment are retrieved or someone is retrieving them. So, in this case, start CPR. Perform cycles of 30 compressions and 2 breaths. Use AED as soon as it is available. So, AED arrives. Check rhythm or shockable rhythm. If it is shockable, then give 1 shock. Resume CPR immediately for 2 minutes until prompted by AED to allow rhythm check. Continue until ALS providers take over or victim starts to move. If there is non-shockable, resume CPR immediately for 2 minutes. Continue until ALS providers take over or victim starts to move. Okay. This is the pediatric basic life support algorithm for healthcare providers. If it's a single rescuer, so verify the scene safety, check for responsiveness, shout for nearby help, and activate emergency response system by a mobile device. And look for breathing and pulse. If normal breathing and pulse is felt, monitor until emergency responders arrive. If no normal breathing and pulse is felt, provide rescue breathing. That is 1 breath for every 2 to 3 seconds. In adults, it is 1 breath for every 6 seconds. So, in children, about 20 to 30 breath per minute. That is rescue breathing. And assess pulse rate for no more than 10 seconds. If heart rate is less than 60 per minute with signs of poor perfusion, then start CPR. If it is no, then continue rescue breathing. Check pulse every 2 minutes. If no pulse is there, start CPR. If there is no breathing or only gasping and pulse is not felt, witness sudden collapse, then activate emergency response system if not already done and retrieve AED or defibrillator. If there is no collapse, then start CPR. 1 rescuer perform cycles of 30 compressions and 2 breaths. When second rescuer arrives, perform cycles of 15 compressions and 2 breaths. Use AED as soon as it is available. So, when the child, it is 1 rescuer, then 30:2 ratio. When 2 rescuers are there, 15:2 ratio. After about 2 minutes, if still allowed, activate emergency response system and retrieve AED if not already done. Check rhythm, that is shockable rhythm. If it is shockable, then give 1 shock. Resume CPR immediately for 2 minutes until prompted by AED to allow rhythm check. Continue until ALS providers take over or the child starts to move. If it is non-shockable rhythm, resume CPR immediately for 2 minutes until prompted by AED to allow rhythm check. Continue until ALS providers take over or the child starts to move. Okay. So this is the basic life support algorithm in pediatrics. So a rescuer who arrives at the side of a potential cardiac arrest victim should follow the steps on the algorithm. This is the first step, that is verify the scene safety, that is make sure the scene is safe for you and the victim, and check for responsiveness, that is tell the patient are you okay, and shout or tap the victim's shoulders. Okay, and if the victim is not responsive, then activate the emergency response system via a mobile device and get the AED or send someone to do so. Okay. And assess for breathing and pulse. So check for pulse. To minimizing the delay in starting CPR, you should assess breathing and pulse at the same time. And this should not take more than 10 seconds. So within 10 seconds, if no pulse is there or no breath, then start CPR. Okay. Then second rescuer come with automated external defibrillator, that is AED. So the CPR started in adult patient. This is for adult and this is for pediatric patient or infants. Okay. So how to perform CPR in a patient? Of a ratio of compression ventilation ratio of 30:2. Rate of 100 to 120 compressions per minute. Position your hands and body to perform chest compressions. Place the heel of one hand in the center of the victim's chest on the lower half of the breastbone or sternum. And put the heel of your other hand on the top of your first hand. And okay, straighten your arms and position your shoulders directly above the hands. Here, this is the exact position. Okay, so heel of one hand in the center of the victim's chest on the lower half of the sternum, and put the heel of other hand on the top of your first hand and interlock it. Okay, and then straighten your arms and position your shoulders directly over your hands. And give chest compressions at a rate of 100 to 120 per minute. At least 5 centimeter depth is needed. So that requires the hard work. Okay. So for each chest compression, make sure you push straight down on the victim's breastbone. So push hard and fast. This is the compressions performed. Okay. And at each, so at end of each compression, always allow the chest to recoil completely. Okay. Minimize interruptions of the chest compressions. So that is about the CPR. Okay. Coming to the compressions for a pregnant woman. Do not panic or do not delay providing chest compressions for a pregnant woman in cardiac arrest. High quality CPR, including respiratory support and early medical intervention, can increase the mother and the infant's chance of survival. So if you do not perform the CPR on pregnant women when needed, the lives of both mother and infant are at risk. So perform high quality chest compressions and ventilation for a pregnant woman just as you would for any victim of cardiac arrest. So visibly pregnant woman approximately 20 weeks is lying flat on her back then uterus compresses large blood vessels in the abdomen. So this pressure can interfere with the blood flow to the heart generated by chest compressions. So here a technique known as lateral uterine displacement. That is manual lateral uterine displacement. This is manually moving the uterus to the patient's left to relieve the pressure on the large blood vessels. It can help relieve this pressure. So, this is the manual lateral uterine displacement. Here, moving the uterus manually to the patient's left to relieve the pressure on the large blood vessels and perform CPR. Okay. So next is the breathe. So give breaths. For breath to be given, we have to open the airway. So airway can be opened using two techniques, that is head tilt, chin lift and jaw thrust. This is the head tilt and chin lift. This is the jaw thrust. In the case of spinal injury patients, the head tilt, chin lift doesn't work. In these cases, use the jaw thrust manual. Okay. And these are the barrier devices for giving breath. This is the pocket mask. This is the back mask. Okay, pocket mask devices and back mask devices. So coming to the next section, that is choking relief. What is choking? How to recognize choking? What is choking? It is foreign body airway obstruction and performs the maneuvers to relieve the obstruction. So these are same for adult and children, that is 1 year of age and older. And for infants, slight difference is there. Okay. So early recognition of foreign body airway obstruction is the key to successful outcome. And it is important to distinguish this emergency from fainting, stroke, heart attack, seizure, drug overdose or other conditions, and that may cause sudden respiratory distress but require different treatment. And this can be minor airway obstruction or minor choking and severe choking. Okay. And this is the universal sign of choking. That is clutching the throat with the thumb and fingers. This making the universal sign of choking. Unable to speak or cry, poor or no air exchange, weak, ineffective cough or no cough at all, high-pitched noise while inhaling or no noise at all, increased respiratory difficulty and possible cyanosis, that is blue lips or skin. This is the advised first aid to relieve from choking in adults. This is using the heel of your free hand to give 5 back blows between the person's shoulder blades. This is the 5 back blows. Okay. And then perform 5 abdominal thrusts. These abdominal thrusts will lift the diaphragm and they force enough air from the lungs to create an artificial cuff. And this cuff helps move air through the windpipe, pushing and expelling the obstruction out of airway and mouth. If you are by yourself and choking, then you can do thrust on yourself. Or you can thrust your abdomen, that is here, this is the upper abdomen. So you can thrust your upper abdomen against the back of a chair or edge of a counter. So you can yourself can do thrust. Okay, abdominal thrust. This is the choking relief in an adult or child. That is abdominal thrust. Or this maneuver is known as Heimlich maneuver. Here, this is the Heimlich maneuver. So abdominal thrust with the victim standing or sitting. So stand or kneel behind the victim and wrap your arms around the victim's waist. So make a fist with one hand. Okay, make a fist with one hand. Place the thumb side of your fist against the victim's abdomen. In the midline, slightly above the navel and well below the breastbone. And grasp your fist with your other hand and press your fist into the victim's abdomen with a quick forceful upward thrust. And repeat thrust until the object is expelled from the airway or victim becomes unresponsive. So cover your fist with your other hand and thrust up and in with sufficient force to lift the victim off his feet. For children, place one fist just above the child's navel with the thumb side facing the abdomen. So universal sign of choking in infants is cyanosis. That is bluish discoloration in the eyes and skin, lips. Okay. That is the universal sign of choking in infants. So what will you do if the infant is responsive and severe choking is there? Then place the infant in your lap, facing head downward, slightly lower than the chest. And with the heel of your hand, deliver up to 5 forceful back slaps between the infant's shoulder blades. And deliver each slap with enough force to attempt to dislodge the foreign body. And after delivering the slaps, so this is the 5 back blows. That is back slaps. Okay. Supporting the back of the infant's head with the palm of your hand. Turn the infant over while carefully supporting the head and neck. Hold the infant face up with your forearm resting on your thigh. And keep the infant's head lower than the trunk. Here provide 5 downward chest thrusts in the middle of the chest over the lower half of the breastbone. Deliver the chest thrust at a rate of about 1 per second. And each with the intention of creating enough force to dislodge the foreign bone. So repeat the sequence, 5 back slaps and 5 chest thrusts until your actions have removed the object or the infant becomes unresponsive. So when an infant becomes unresponsive, stop giving back slaps and chest thrust. Start CPR and starting with the chest compressions. So basic life support protocol to be followed when the child becomes unresponsive. Okay. Do not perform a blind finger sweep because it may lead the foreign body back into the airway. How to prevent choking in adults? Food cut into small pieces. Chew food slowly and thoroughly, especially if wearing dentures. Do not talk and laugh while chewing and swallowing, and do not drink lots of alcohol before and during meals. In children, cook hard food until it is soft enough to pierce with a fork. Remove all bones from fish, chicken and meat. Grind up tough meats and poultry. Remove seeds, pits and tough skins and peels from fruits and veggies. And chop food into small pieces no larger than half an inch. You can also simply grate, mash or puree food. This is especially important for raw fruits and veggies that are harder to chew. In pregnant ladies, if choking occur, then ask the person if they are choking. Give back blows. Give 5 back blows between the shoulder blades with the heel of your hand. Here the patient is pregnant, so instead of giving abdominal thrust, giving 5 chest thrust. Chest thrust for a conscious adult are like abdominal thrust, except for the placement of your hands. So for chest thrust, place your fist against the center of the person's breastbone. Then grab your fist with your other hand and give quick thrust into the chest. If they are still choking, repeat the steps 2 and 3, that is back blows and chest thrust, until the object becomes dislodged and they can breathe normally. And if they are still choking and lose consciousness, call for emergency services and start CPR. Okay. So, other life-threatening emergencies. BLS providers may be called to respond to life-threatening medical emergencies that have not yet progressed to cardiac arrest. Some of these emergencies are heart attack, stroke, drowning, anaphylaxis, and opioid-associated emergencies. So coming to the heart attack, heart disease is the leading cause of death in United States for both men and women for decades. Every 3 seconds around the world, a person has a heart attack. So the signs of heart attack, it may occur suddenly and be intense. So what are the signs? Chest discomfort, pain or discomfort in the chest, discomfort in other areas of the upper body, lightheadedness, nausea or vomiting, jaw, neck or back pain, discomfort or pain in the arm and shoulder, then shortness of breath. So these are the warning signs of heart attack. So early recognition, early EMS activation, early transport of EMS and early intervention for someone with a suspected heart attack is critical. Goal is 90 minutes from initial contact to treatment intervention. So, learn to recognize the signs of attack, activate the emergency response system without delay, give aspirin if indicated, be prepared to start CPR if the victim becomes unresponsive. That is about the heart attack. Coming to stroke. Every 3 seconds, someone in the world has a stroke. Stroke occurs when blood stops flowing to a part of the brain. Warning signs of stroke. Use the FAST method to recognize and remember the warning signs of stroke as FAST. F for face drooping, A for arm weakness, S for speech difficulty, and T for time to phone emergency number. And the critical concept is the stroke is a time critical emergency. Every minute treatment is delayed, more brain tissue dies. Priorities are early recognition, limited scene time, transport to the appropriate facility. Coming to the drowning. This is the third leading cause of injury death worldwide. And the first and most important action for a drowning victim is to give rescue breath as soon as possible. And this action increases the victim's chance of survival. Coming to the anaphylaxis. Most allergic reactions are mild, however, worsen to a state of anaphylaxis. It is a severe allergic reaction that requires urgent treatment. And the treatment may include epinephrine injection. So immediate injection, the first and most important action for someone with suspected anaphylaxis is to give an immediate injection of epinephrine using epinephrine auto injector. So this is the most important action who suspected with anaphylaxis. Coming to the last one, that is opioid associated life-threatening emergencies. Scene assessment is an important tool to identify whether opioids may be involved in a life-threatening emergency. Which are the signs of opioid overdose? Slow, shallow or no breathing, choking or gurgling sounds, drowsiness or loss of consciousness, small constricted pupils, blue skin, lips or nails. So antidote to opioid overdose is naloxone. And that's all for today's lecture. Thanks for watching. Please do like, share and subscribe my channel.